Hello everyone, you might have heard of the term molluscum. It looks typically like this, and would you know how to get rid of it? Well, in this video, I'm going to go through the best ways of getting rid of molluscum and how to stop it spreading. So let's get started. What is molluscum? Well, let's face it, molluscum can be very annoying. You start off with one, you might end up with a few more, and you're not sure how to get rid of it or how long it's going to last. Well, molluscum is a common viral skin infection. And this virus then causes small little bumps on your skin. They kind of look like a wart, but they're a different virus and they look completely different. They're generally much more common in children than they are in adults, and especially children with conditions like atopic dermatitis and eczema. They're also much more common in adults who have a compromised immune system, like conditions like HIV or cancer, which are lowering their immune system. What causes molluscum? Well, molluscum is caused by the pox virus, and there are around 4 different subtypes of this virus. The main ways that this virus can spread is direct skin-to-skin contact, so touching someone else with the infection, indirect contact, like sharing a towel or something with the virus on it, spread by transfer, so for example you have a molluscum spot on your face and you shave it or tweeze it, and then that same instrument is touched elsewhere, that can spread the virus. And the other way is from sexual activity. Transmission appears to be much more likely in wet conditions, like when people are swimming. After you have the virus, it can take between 6 weeks and 2 months for the virus to cause spots on the skin. We call this the incubation period. What does molluscum look like? Well, molluscum appears as small clusters of round papules. The size of them can vary between 1 millimeter and 6 millimeters. They can be white, pink, or brown in color. They often have a waxy or shiny look with a small central pit, so a dent in the middle. Each of these papules contain a white, cheesy material. In some cases, some people can get hundreds of small papules. Places where you often get this infection are in moist areas, so like your armpits, on your groin, your genital area, or behind your knees. They don't occur on the palms of your hands or the soles of your feet, so if you have lumps in these areas, it's not usually because of molluscum. How is molluscum diagnosed? Well, a doctor will generally diagnose molluscum by having a look at it, and in some cases using a dermatoscope, a special camera to look at lumps in detail. If we're not sure what the lump is after having a look, we might take a small sample and send it to the lab for testing. What is the best treatment for molluscum? Although it can be very annoying, it generally will disappear on its own. In some cases, the lumps might stay for up to 2 years, but in around half of the cases, within around 12 months, the lumps are gone. However, if you get exposed to the virus again or in contact with someone else who has molluscum, you may get another infection. If the lumps are present and they have been for a long time, your doctor might do some additional tests, like check your immune system to make sure that there's no other reason why these lumps are not going away. What are the best treatments for molluscum? Well, there's no single best treatment, and you have to bear in mind that often these lumps will go away on their own without treatment. So, because some of these treatments may cause side effects, you might prefer just to wait and see if they disappear. However, if these lumps are on your face or they keep growing, there might be treatment options you want to consider. The main types of treatments for molluscum usually involves physical treatments or medical treatments. Physical treatments that your doctor might consider include curettage. This involves using a small tool to see if you can just pop the molluscum, but this can leave a scar, so it's often not preferred. Cryotherapy. Cryotherapy is another method, and that involves using liquid nitrogen to see if you can freeze off the molluscum. But again, this can in some cases scar, so your doctor will need to discuss this with you. Next way is medical treatments. Now, these treatments involves things you put on the molluscum. One option is salicylic acid. This helps the skin get a little bit irritated and your immune system to recognize something's going on and there's something that they need to fight, like the virus that's causing the molluscum. Another cream that might be used is tretinoin, vitamin A. So again, this is commonly used for other reasons like wrinkle prevention and keeping your skin healthy. Tretinoin, when used with molluscum, causes a little bit of skin irritation again, and therefore your body again knows that there's something it needs to fight, the pox virus. And this is a gel that's come out in 2024, and your doctor might consider using this if it's been approved in their medical guidelines. Another cream that is considered is an antiseptic cream, such as a hydrogen peroxide cream. Safety advice, my top tips. My top tips is to make sure you see a doctor before you start treatment. This is because we need to be sure of the right diagnosis to make sure you're getting the right treatment. Number 2, we need to monitor you for side effects. If we start one of these creams or treatments, it could lead to scarring or skin irritation, so it's important to discuss the symptoms with us. Make sure you see us before you start treatment. Number 3 is a lot of these medications are prescription-only medications, so therefore it's not safe for you just to buy it on the internet because you don't know what you're putting on your skin. How do you prevent molluscum? Well, molluscum is infectious when it's active. So if you have the virus, it is possible to spread the virus to other people or in other parts of your body. To reduce the spread, keep your hands clean, avoid scratching or shaving the area so you don't spread the virus. Cover any bumps with plasters, and this is because you want to prevent yourself touching them or other people touching them. Don't share towels or clothing with other people. And remember to practice any sexual activity safely. Commonly asked questions. Is molluscum the same as genital wart? No, they are not the same. They are caused by different viruses. They also generally look very different. Molluscum is caused by the pox virus and genital warts is caused by the human papilloma virus. Can you get molluscum from swimming pools? As I mentioned in this video, it's most commonly transferred from skin to skin or when you've got one somewhere and you spread it to somewhere else on your body. So whilst it is possible to spread it in other ways, it's much less common. And it's okay to go swimming if you've got molluscum, but it's best to keep that area covered up when possible. When does molluscum stop being contagious? Well, when the bumps have disappeared, you no longer have an active infection and therefore you're not contagious. Thank you for watching today's video, and if you found it helpful, please can you click subscribe as it really helps my channel to keep growing. If you've got any comments or you found the video useful or you've got other questions, please write down a comment below and I'll get back to you. Thank you for watching.